I think we're in the very early stages of what will grow and grow and grow.
Bob Wachter for years has been the voice of hospital medicine, first coining the term hospitalist with Lee Goldman in a 1996 New England Journal of Medicine article. He's a past president of the society and an inaugural master of hospital medicine. He currently is chair of the American Board of Internal Medicine, and he's professor and associate chairman of the Department of Medicine at the University of California, San Francisco. Dr. Wachter has for 2 decades sounded the drums of quality improvement in healthcare. He's encouraged hospitalists to own the quality conversation, making patient care better at the bedside and better system-wide. But this year in his closing HM13 keynote, Dr. Wachter added a new wrinkle to the equation: cost and waste reduction.
Up until 2 or 3 years ago, we had it pretty cushy. The pressures on us, those of you who were practicing in the mid-90s will remember an era where the pressures on us to cut length of stay, we're talking about bed days per thousand, to cut the cost of hospital care, the pressures were pretty intense. And that actually was the cauldron from which our field began to grow. But then our society said, we hate this, and said, we don't like this managed care thing, make it go away. And it basically went away for 15 years. And so we had a pretty luxurious 15 years where we were being pushed for the first time to improve quality and safety and the patient's experience, but we really weren't doing it under tremendous economic pressure.
Dr. Wachter acknowledged society is asking more of the healthcare system and its leaders.
If we look at the value equation, the numerator, quality, safety, patient experience, really important, but so is the denominator. And if anything, the pressure to get the denominator right is going to grow very quickly and ultimately be more pressure, and we're already starting to feel it, than the pressure that we have on the numerator side.
Hospitalists are inundated with new rules, policies, and penalties, yet financial incentives don't seem to work well in healthcare.
People really respond to a feeling of value, a feeling of worth, people getting joy in their work, feeling like they're working for a purpose. And so it's not that extrinsic rewards like bonuses have no role, but I think there's a risk that we'll overemphasize them and not pay attention to the things that really motivate hospitals to do the right thing, which is the patient.
He believes this new challenge will require new skills and a new commitment.
It's quite clear to me that cost is now going to be the dominant issue for the next 5 or 10 years. The world has figured out that if we don't get a handle on cost, we'll bankrupt our country. And so it's really important that hospitals lead on cost the way they've led on quality and safety. It's a little bit harder because the politics are harder. If you're cutting costs, you're probably cutting someone's paycheck. There's some new skills that we need to learn, like Lean or Toyota production system kind of skills. We need to learn something about accounting, which none of us went into medicine to learn. But I think what we've seen at this conference is it's interesting work, it's important work, it's fulfilling work, and we're seeing emerging leaders in cost and waste control the same way we saw leaders in this field in quality and safety.
Dr. Wachter delivered the same message to HM13 attendees that he delivered to his own group. Quality and patient safety is not enough. We need to focus on reducing cost and waste.
We need to integrate cost reduction, waste reduction into our quality, safety, and patient's experience work. In other words, we have to take the value equation and approach it holistically, not just looking at the numerator.
He outlined ways hospitals should prepare and differentiate between quality-focused projects and projects that look at cost and waste reduction.
There are some new performance improvement skills that we need. You could have done quality improvement and not, for example, known Lean or known Toyota production system or known Six Sigma. I think it is important for at least some of us to get trained in this systematic way of approaching cost reduction and decreasing waste. I think you need some new analytic skills. You could have gotten by in patient safety or quality improvement and said, I don't want to learn any math. But I think as you approach cost, there is math on that test. You actually have to either know some economics or accounting or bring in someone who knows it for you, because you very quickly begin to talk about direct versus indirect costs and things like that. You also, this may be the most important difference of all, you need new political or diplomacy skills. If in the old days you were about improving quality or improving the patient's experience, you probably weren't pissing too many people off. But the minute you begin to focus on waste, I can tell you the moment we began to talk about we're doing too many CAT scans, can we decrease the number of CAT scans? I got a call from the chairman of radiology about a nanosecond later saying, I hear you doing this work on CAT scans. Could I participate in that? The message was very clear. This is how we pay our faculty. This is how I pay my mortgage. And so if you think about it, cost reduction, waste reduction has to be someone's bottom line. You're impinging on that bottom line. We have to do it, but you have to be sensitive to some of the politics. That's a skill that I don't think was nearly as important when you were working on the numerator of the value equation.
For more HM13 coverage, visit thehospitalist.org.